Well, the big news is that the government is all set to roll out the COVID vaccine next week. Health Secretary Rajesh Bhushan said yesterday that it would happen within 10 days of the emergency use authorization being granted. And the Indian regulator, remember, granted that emergency use authorization on 3rd of January. So we can estimate around the 13th is when the vaccination program will roll out. Now, the drug regulator has granted a restricted emergency use authorization to two companies, Pune-based Serum Institute of India for Covishield, the vaccine that has been developed by Oxford University and AstraZeneca. And then you have the Hyderabad-based Bharat Biotech that's developed Covaxin in collaboration with the ICMR. Now, the vaccination drive will simultaneously begin across the country to initially inoculate 3 crore healthcare and frontline workers. The government has already uploaded data related to these recipients on CoWIN. That's the IT platform that will be used extensively to implement the immunization and track in real time the entire immunization process. And when it reaches the rest of us, that is the website where we'll have to go and register to get vaccinated. So lots of questions on everyone's minds regarding the vaccination program. And we have our experts in studio with us on the show today to answer some of those questions for you. We're joined by Dr. Rakesh Mishra, Director, Center for Cellular and Molecular Biology, Hyderabad, Professor Bhramar Mukherjee, Health Data Scientist, Chair of Biostatistics at the University of Michigan, and Anant Bhan, a researcher in bioethics, global health and policy. Thank you all for joining us. So yes, we're on the cusp of this massive vaccination drive that's about to take place. Dr. Mishra, first to you, what are the challenges that you foresee ahead? Because, already we're seeing in the United States and in the UK, the vaccination rollout has been not as fast as one would have expected, to put it mildly.
See, any activity which involves people at such a large scale will have a certain, at least breathing troubles. One advantage India has that we have very strong vaccination program already, is the best in the world at the moment. So these countries who are doing large scale vaccination, they were not doing it before. So for them it is something new. For us, this is something which we do regularly, and as has been done with the dry runs and as has been done with the monitoring of the vaccination program and registration. India has very strong IT backbone. So I think those logistic problems which we are seeing in other countries, we might see much less in our place. And also there is very clear guideline that first 1 crore people, then 2 crore, and then 27. So we will learn many things and optimize and standardize some of the things which are not immediately in the place. So I think everything is planned pretty well, and we are just looking forward to Pongal and start vaccination program. I don't see any major issue because we are used to such things.
Well, let's hope so. Professor Mukherjee, what would you say about how slow the process has been in the United States, and what has been the problems and obstacles?
Yes, so there has been unanticipated delays in the United States, and though everybody is trying, of course, the storage of the vaccine and the dissemination due to the Pfizer and the Moderna needing very cold temperatures has also been an issue, and also dissemination and vaccine hesitancy is much more of an issue in the United States than in India. So have everything together, and I can say from my experience in Michigan that people are working night and day. Everybody's volunteering for vaccination, but still in a risk stratified way, how to disseminate it to a large group of people and also reach the rural and interior part with this kind of storage mechanism has been challenging for a system which is particularly under a lot of pressure treatment of a large number of COVID patients. So that has also slowed down the process.
All right. And Anant Bhan, what do you see as the challenges ahead? Fortunately, the vaccines that we have, unlike Moderna and Pfizer, will not require these very low temperatures, so easier to move them?
It's certainly going to be easier to move them. I think both the companies have indicated that they have already started stockpiling doses. Serum has said that they have around 100 million doses, and I think Bharat Biotech has said that they have around 10 million doses. So that's a significant number of vaccines already available or going to be available over the next few days. And then it's a matter of taking it from the production facilities to the national depots and then the state level, district, sub-district level depots. So I think, a lot of that has been tried out in the dry run, but we'll have to wait and see over the next few days if there are any more troubles when you do it at a national scale. I guess one challenge potentially could be CoWIN platform and data connectivity in some parts of India, given that that can be a concern sometimes at the sub-district level, but I'm sure with a manual registration and a backup system that could still work. Again, we'll have to wait and watch, but I think as Dr. Mishra said, I think we have a lot of experience behind us, but this is also a new ball game. We are working with a new set of age groups, which we conventionally don't vaccinate because our vaccination program right now focuses on pregnant women and kids under 5. This is going to be adults, so, we'll have to see if there are any issues with that. But with the voting and election experience and then our vaccination experience, I think we'll combine the both and hopefully be able to deliver.
All right, well, let's just get in some of the questions that people have sent to us, and let's listen into this question by Elisha from Delhi.
Hello, doctor. I'm Elisha from Delhi. Is it mandatory to take the vaccine for the people who have had COVID before?
All right, Dr. Mishra, I'll put that to you. And of course, Elisha won't get it just yet because she's very young right now. But yes, she wanted to know if it's mandatory for people who have had COVID to take the vaccine.
Yeah, it's not mandatory. In fact, I'm not sure if it's mandatory for anyone.
Sure.
Because this is emergency usage vaccine, so people should take it. They are advised, but they can't be forced as far as I understand. But considering the choice that if a person already had COVID-19 and has recovered, so advisable we thing will be to take the vaccine, because you may have recovered for many other reasons and you may not have the memory cells or immune system primed to take the new vaccination. So experts' opinion is that if it is you are falling in the group and availability is there, it's good to take. These vaccines are very safe, so it's good to take them.
All right, we have a tweet question to us. Punya Samal asked, is the vaccine safe and effective for people with severe asthma and allergic rhinitis? Is it a high priority for people with asthma to get the vaccine? Professor Mukherjee, so, because we do have the people with comorbidities in the priority list, so people worried about these various afflictions that they may have.
So I think I'm going to delegate that question to Dr. Bhan or Dr. Mishra, because I think that in the clinical trials, there is not usually enough data for people with severe comorbidities, such as the selection bias for clinical trials. When you roll it out in the real world, that's when you get the effectiveness data. And that's when you get to learn about what happens to real world patients with lots of other medications and comorbidities. So right now, I think that people having type 2 diabetes, heart diseases, and respiratory diseases at a high risk priority.
Right, Dr. Mishra?
Yeah, so I agree. In fact, these are the people who should be given the vaccine because they have comorbidity. So they will be, even if they are under 50, they will be qualifying to get it. But please remember, these are emergency use approvals. So we have to keep close connect with the medical system, and people with such conditions should be monitored more carefully. And I think system is gearing up for that. But going by the results of phase 1, phase 2 and phase 3, whatever data is available, anything else can be discussed, but these vaccines are pretty safe. So that should not be really any major issue. And as we know that less than 18-year-old people and pregnant women will not be given this vaccine because you don't want to take chances. They are not being tried on that. But otherwise, as far as I understand, there is no issue.
All right, we have another question from Serum from Hyderabad.
Hi, this is Serum from Hyderabad. There are various rumors going around the COVID vaccines we are anticipating, but at the same time we are a bit anxious how these vaccine will turn out to be. My serious question here is, how many rounds will we have to go through for this vaccine? Is it one-time process, or do we have to repeat the vaccination maybe once, twice, or thrice? And my second pertinent question is here is, how safe it is for kids? Will government first be trying it on human beings or on general masses, or directly give it away to kids as well?
Right, Anant,
I hope my second question gets answered first, and on serious note, because I'm really concerned for the kids. So thank you.
All right, Anant, I think I'll let you answer that question.
Sure, both great questions from the viewer. So on the first one, right now the vaccines that we have are 2-dose vaccines, and typically there is a spacing between the 2 doses, usually around 28 days, though it might be slightly higher depending on what the government finally ends up recommending. So what will happen is when you register for the vaccination, you will be told when to come up for your first dose, and also you will get reminders for your second dose, but you will need to go twice to get both of your doses. There are some vaccine candidates which are supposed to be single dose vaccines, but those are still in clinical trials. The 2 vaccines we are talking about right now for usage in India are 2-dose vaccines. On the second question, as Dr. Mishra said, right now we have only regulatory permission for usage of these vaccines in those above 18 years of age. Again, clinical trials are ongoing, which will be looking at a younger age group. But as and when that evidence comes, the age group might be expanded. But as of now, it will only be available for those who are above 18 years of age.
All right, we have another question from Divij Shah. It's a tweet question where he asks that we've seen a decrease in cases in recent times here in India, and some say it's herd immunity, some say there are discrepancies in reporting of cases. Every state's curve has almost flattened near to the x-axis. Professor Mukherjee, I'd like to ask you about this because it's very curious, because around the world, the way we're seeing it in the US and in the UK, the cases are just spiraling. And fortunately, and of course, we have to remain on our guard, but here in India, they've gone below 20,000 for the last couple of days.
Yeah, so I think that's great news, and that's one of the mysteries of what's happening with the virus curve, where almost in all places in the Western world, we have seen a second and a third peak and a large number of cases, particularly in the winter. And that winter phenomenon has not happened in India. And I think the reason, and everything is conjectural at this point, right? So people have postulated cross immunity, genetics, but I do think in the big metros, the Sero surveys actually show that approximately 1 out of 2 people already had the infection, and silently, without even knowing it, the degree of COVID infections is very high. And so that may be a reason why the virus is actually facing a human barricade, because many people have already had it. And in the rural areas, that's quite a mystery, that even with the imported cases and travelers, why it has not exploded yet. And one hypothesis contrasting from the Western world and the Eastern world, of course, there is a hygiene hypothesis, but I also believe that the outdoor lifestyle in rural India and lack of use of air conditioning and heating system, which makes, like we already know, that indoor aerosol transmission is one of the main pathways for this virus. So that's my conjecture, but we'll not know a causal interpretation unless we tease apart all of these competing hypotheses.
Absolutely. It is something very, very curious. And at the same time, of course, we have to remain on our guard. We don't want to see that third or third wave happening in parts of the country. We have another question from Anjali. Let's listen in.
Hello, doctor. I am Anjali from Delhi. And my question is, Bharat Biotech vaccine has been approved without data from the 3rd phase trial. In such a situation, how safe is this vaccine?
All right, Dr. Mishra, first to you.
So it's a good question to ask. A vaccine is first even given the phase 1 trial only when there is ample evidence that it is safe for people. So animal testing are done, primate testing is done. Then after phase 1, which is largely a safety data, if you inject to fewer people, it is safe. Then you go to phase 2 when there are several hundred people will be injected. And then phase 3 means tens of thousands of people are allowed to be given the vaccine and placebo in a randomized way. That means if something has entered phase 3, you can take it almost for granted that it is a safe vaccine. The efficacy of vaccine is the one that comes out of the 3rd phase 3 trial. And phase 4 is the one that actually gives the real value of the vaccine, how good is going to be in future in coming years and decades. So as far as your concern for safety is, all these vaccines that are given emergency usage approval are safe vaccine. Each vaccine, whether these are even approved vaccines, regularly used vaccine, they will have minor symptoms of headache or but you should take it for almost like granted that these are safe vaccines.
Right. Anand Bhan, I want to get Anand in here also because, given the manner in which the emergency use authorization was given without that data, so it has created a bit of doubts or, it's been a bit of a controversy, and not to say that the vaccine isn't safe or it's not going to be efficacious. Hopefully that data will come out. But because of this issue, it's something that was a huge achievement for the country, this indigenously developed vaccine. It's created a bit of a cloud over it, isn't it?
It has, but I think, let's go back to the question, Gargi. No vaccine is 100% safe. Even the established vaccines we have had for many years can have some side effects, 1 in a million, even rarer chances. So, vaccines do come with some side effects. You need to be aware of that and you need to be prepared of that, especially from the health system side. As Dr. Mishra was saying, so far what we know from the Bharat Biotech vaccine in the initial trials, phase 1, phase 2 seems to indicate that the safety profile is fairly decent and there's nothing major to worry about. It's also an established platform. That having been said, we will know more as phase 3 happens. Right. With efficacy, we'll also know more about long-term safety. In fact, we'll know more about long-term safety for all of the vaccine candidates, including Pfizer and Moderna, over time. As you have seen with Rollout, there have been adverse events reported in the US and UK, and that is true of any vaccine. So it's very important to be watchful, know what to look out for, and report to a health center immediately if you have any adverse symptoms.
All right, we have another tweet question from Lingaraj Satapathy, and first he asks if the vaccine is required for all, but his second question is that does it work like the polio vaccine, that if one vaccinated then it's not required in the future? Professor Mukherjee?
Yeah, so right now, as Dr. Mishra pointed out and Dr. Bhan pointed out, that it is not required for anybody. And so because it's emergency use authorization, it's recommended that you take it, but it cannot be mandatory for anybody. It's, after all, your personal choice. And that's why it's important to have the data out there in a very transparent manner and not associate such opacities, because people want to know whether it's safe, but also want to know between choosing 2 vaccines, which one is more efficacious. And at this time, we only know about efficacy. We do not know about real-world effectiveness. So we do not know. And this was a previous question as well. Right now, we have 2 doses of the vaccine constituting all the clinical trials are based on that. Whether this is long-term immunity or if the virus strain is going to mutate. And for example, I take the flu shot and the flu vaccine every year. Right. But so because the virus changes, so it may be that, but we do not know yet whether future shots of the vaccine and how long this immunity is going to last.
Absolutely, and we're already seeing the virus mutating. Well, thank you all for joining me on the show and taking all those questions from our viewers. And we have many, many more questions. So I think we're going to be doing this every single day and asking a lot of questions to all of you experts. Thank you for joining us. Time for us to slip into a short break. Coming up on the other side, we'll take a look at the situation in Scotland and also UK's policy regarding the vaccine. It's extended the time between the first and second dose. Is that something that other countries should follow? Welcome back. Well, let's now take a look at the situation in Scotland. And like in England, Scotland too has been placed under lockdown, and Scots have been ordered to stay home amid the fresh COVID lockdown, which will see schools remain closed to pupils until February. The new laws also require people to stay home and work from home as much as possible. Outdoor gatherings have been absolutely cut out, and the situation, though we're seeing, you can see that spike there, the number of cases being reported is increasing. We're joined now by Dr. Aviral Vatsa to talk more about the situation in Scotland. Doctor, if you can tell us, about the number of cases are spiraling, and hopefully this lockdown being declared should bring it under control somewhat.
Indeed, as you said, the situation is quite worrisome because the new strain is spreading quite fast, and so much so that, especially in England, even the lockdown measures which were taken during December time, the restrictions, not the lockdowns, they did not help in curbing down the spread of infection, and that infection has reached also Scotland, and the cases are on the rise. However, it's worse in England than in Scotland, but nevertheless, the worries are also here in Scotland. As you probably already know, the First Minister of Scotland, Nicola Sturgeon, she has announced a total lockdown till middle of February. So that is similar to the situation we had back in March and April. It's actually more worrisome than it was at that time. because the standard measures are not helping yet to curb down the infection. And if I could add, if I could add to that to give you a number that, especially in England, the numbers are that from anywhere between 3 to 6 beds per hospital are already filled up with COVID patients, which is very, very alarming. And it is expected that in the next couple of weeks, at least it will take another 2 to 3 weeks for this to I wouldn't say to flatten the peak, but at least that's where it starts to stabilize. So we are looking down the barrel for another 2 weeks at least.
All right, so that sounds quite worrying down the barrel. And just tell us, how is the vaccination program there proceeding? We're waiting for it to begin here in India, but we do know there have been complaints about how slow the inoculation has been going and trying to keep up with the spread of the virus.
The vaccination program is definitely, it's surely lagging behind the spread of the new strain or the spread of the virus. And initially, the doses we got for the Pfizer vaccine, they have all been kind of used up. The first doses were used up, and we're waiting on the Oxford vaccine, which has been rolled out from Monday. We are expecting that it'll speed up because the logistics are much simpler and the doses are coming through. And the second decision the other decision by the UK government, including the Scottish government, that we will only give the first dose to start with of the Pfizer vaccine, and the second dose has been delayed. And that second dose, which are reserved for the people, that is to be given to other people as first dose. Now, that is a step to increase the coverage of vaccine in the public. There is very little scientific evidence, tested scientific evidence behind that the immunity shall last beyond few weeks' time, but it is just it is the likelihood that the immunity will likely last beyond that, and then if we have more number of people who are relatively safer against the virus, then probably we are better off. So that's the thinking behind it. As I said, there is no hardcore scientific evidence behind it because the vaccine companies have not tested immunity after the first dose beyond a few weeks' time. So the vaccine is expected to pick up. It is slowly picking up, but we are definitely lagging behind. And as you are mentioning, the fatigue is setting in across the healthcare systems.
All right. Well, thank you so much, Dr. Vatsa, for speaking to us here at NDTV, and all the best ahead. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.